I'm Jennifer Sanasi. You're watching News 24 Live. Well, I'm joined in studio by our in-house doctor, Dr. Darren Green. Now, Dr. Green is going to be answering your medical questions. Let's take a look at the first question.
So I think the first thing is step away from the trigger. Get away from the thing that's causing eczema in the first place. And I think the biggest challenge lies in the fact that most of us don't know what's causing our eczema. And I think from a young age, you'll notice children start developing eczema. Now, most people don't actually know what eczema exactly is, and they use it as a term for any skin lesion.
Right.
So eczema refers specifically to an immune-mediated rash that's associated with an allergy specifically. It looks very different in different people. You get different stages and forms of eczema. You get eczema that is dry, which is flaky, dry, red patch. You also get wet eczema, which we call weeping eczema, which can cause cracks in certain parts of the skin and then get secondary infection and bacterial infection and lead to things like cellulitis, which is a soft tissue infection. So eczema as such has got a spectrum of involvement, and its clinical picture can look differently at different stages. And the treatment obviously is matched to that. This person wants to know how to prevent it, and to prevent it, I'm afraid you need to find out what's causing it. And that would mean obviously consulting your specialist physician and having the correct tests done on blood work with a thorough history-taking process, etc. In my practice, I often ask patients to bring along a diary of what they eat for a full week or 2 weeks so that we can go through it. We look for an associations as to what season the eczema is worse. And then you can kind of get an idea whether the triggers are actually dietary or nutritional or environmental. Often you'll notice people develop eczema when they go into certain parts of the country, when traveling or on holiday, for example. It's often associated with other systemic signs of allergy, you know, like your hay fever, your allergic rhinitis, your sinus congestion, etc. So you've got to look at all that in a holistic way, and certainly keeping a very meticulous record of what you're eating as well as the time and association is crucial to finding and getting to the root of the problem.
In your experience, your patients who have eczema, have they been affected by the environment or what they've been eating?
I think in kiddies particularly, they live very close to the ground and they often are associated with environmental triggers.
Right.
Because if you think about children, we introduce foods in a very systematic, slow way. And if we notice a skin rash after giving a certain fruit or a tropical fruit or vegetable, for example, or nuts, we normally see it quite soon afterwards. But you know, as you go through adulthood, it gets a little bit more difficult to differentiate between the two.